group 28, and I'll be making a demonstration on tipping and the introduction to communication. Stay tuned. Yes, you have it, sir. Yeah. So, Mr. Taylor, how are you doing today?
I'm fine.
So are you feeling any pain?
Not at all. I'm getting better, actually.
Okay.
So I just came around to tell you thank you very much. I really appreciate your time.
I'm glad everything
Thank you very much. I'd like to also...
No.
Thank
You
you.
don't do that.
Thank you very much.
You're welcome. Hello. Yes. So how are you feeling today?
I'm feeling pain.
Oh, on a scale of 1 to 10, how intense is your pain? 10. Wow. Okay. Are you feeling feverish?
Yeah.
And where exactly is the pain located? Where are you feeling? Oh, okay, sorry. So we'll call the nurse now and perform some other tests, and we'll know the next line of action.
Okay.
So my patient line here is an 83-year-old patient with appendicitis. So the risk factors of this patient includes the patient's old age and the fact that this patient is malnourished. So as a result, the recovery time will be longer and will require more procedures to make the patient back to his normal self. And as you can see, when I asked the patient how the pain was, it was discovered that the patient had an intense and sudden pain. As a result, this is an acute appendicitis. We're talking about the introduction to communication. Communication is the exchange of information between two people. As we know, communication is an essential part of patient recovery, and through communication, a physician or a nurse actually knows how to speed up the patient's recovery process, because you know how the patient is feeling and you can find ways to speed up the recovery process. So there are two types of communication. We have the verbal, which involves the use of spoken words, where the patient tells you how they are feeling and tells you the things they actually need. And we have the non-verbal, which involves body languages, where you can see how the patient, if the patient is in pain, where the patient shows you signs. And as we know, body languages and non-verbal means of communication is actually essential, because if a patient actually sees how the physician is trying to communicate to the patient can get angry, or the patient can be afraid of actually expressing his or her feelings. That is, if the physician isn't showing a good body language. Thank you.